All right, Dr. Henderson here talking about another surgery. So this video, we're going to talk about what everybody calls a TURP, or transurethral resection of the prostate, TURP. My older gentlemen or patients always kind of tease, but they call it the roto-rooter, or cleaning out the pipes. Really is just for those patients who have BPH, or benign prostatic hyperplasia, and your prostate gets bigger, and as it gets bigger, it pinches down on your urethra so you can't pee very well. Symptoms of this are very common. Most men just try to ignore them until they get too bad, and it's probably better if you come and see us and get these procedures done before that. If all of a sudden you say, man, I haven't sat by the window on an airplane for years because I know I need to get up and go to the bathroom, or every single time we go into a movie, I miss half the show, or if I go to the football game, I miss the whole fourth quarter because I'm in the bathroom going constantly. You need something done. We usually start conservative with medication, and then we move to different procedures. A TURP procedure, when you talk about the American Urological Association guidelines, or the AUA guidelines, is fit for somebody with a prostate 30 grams or smaller and 30 to 80 grams. The procedure is very simple, and it's much more improved compared to what we used to do. Now it's a same-day procedure. You go home same day. There's very minimal blood now in the catheter like there used to be. They used to admit patients to the hospital for this and do all these irrigations and things. Now we either use a laser energy to vaporize the tissue, or we use a bipolar current that vaporizes the tissue even still. The fluid that we run through the urethra so that we can see while we're doing the procedure is normal saline. So it's just like getting an IV bolus. If you've ever had an IV in the hospital, we could give that to you all day. We're not going to hurt you at all. Usually about an hour or less. It depends on the size of your prostate. All we're doing is going through the urethra. So again, no cutting. We just kind of vaporize out the inside of the prostate. So we vaporize through the urethral tissue inside the prostate, and we kind of just core out the whole thing. The reason we do these types of procedures this way is your nerves for erections and continence are on the outside of your prostate. And so I don't even want to get near the capsule. I actually don't try to take out all the tissue on the inside because I don't want to get near those nerves and mess up your sex life, heaven forbid, or have you in diapers or pads or something like that. So we go through, we vaporize out the inside of the prostate, kind of like taking an apple core out of the apple and make everything wide open again. The nice thing about this is you can quit all of your BPH medication, tamsulosin or Flomax, finasteride, tadalafil or Cialis, all that stuff you actually don't need to take anymore because this procedure is so effective. Afterwards, the worst part about the whole procedure is the catheter. No guy likes the catheter, so you're gonna hate me like crazy for the catheter for 1 week. There's gonna be irritation, there can be some bleeding in and out of the catheter through the urine, and we really don't care about that much unless it's super thick and it can clot off the catheter and clog it. That would be a reason to call us right away or potentially go to the emergency room, but it doesn't happen that often. Once that catheter's out in about a week's time, and studies show about 5 to 7 days is the best for healing with a catheter when you've had a urethral procedure. Once that catheter comes out, you'll hate me a little less, but you'll still hate me. You have this open wound now inside there. It's a very hard place for your body to form a scab because there's acidic urine constantly bathing this area. So you are pouring acid on an open wound. You can imagine how much you're still gonna hate me. It's not very fun. Happens for about 2 weeks. By that time, form a nice little scab in there, and you don't get that burning anymore. You don't get that urgency. You don't get the bleeding that's causing discomfort. And so guys hate me at that point a lot less. And in fact, going into like the month or 2 months, most guys are starting to give me a high five and say, this is great. I can drill a hole in the wall, write my name in the snow, all the fun things I used to do as a kid. There is one caveat to that. Your bladder, for the last however many years you've been fighting your BPH, your obstructing prostate, has a big, thick muscle wall now, like the Rock Johnson. And he is going to have to shrink back down like Dr. Henderson. So the only way the Rock is going to lose that muscle is if you quit telling him to work out. But it's still going to take him a month or 2 or 3 months for that muscle to shrink back down or get flabby. Truthfully, you only need a paper thin bladder muscle because usually gravity does the rest. So you just need a functioning muscle, but we don't want an overly big or developed muscle in our bladder. So it takes time for that to calm down, to get rid of the urgency, the frequency, feeling like you need to go pee. I tell guys sometimes you may even leak after the procedure. It doesn't mean to anticipate you're gonna leak the rest of your life. We can do medications, we can even do Botox injections in the office, not to make your bladder look young and pretty like your wife. It's to paralyze the back wall of your bladder so it can't squeeze as hard, and so there's less urgency and frequency. And by the time that bladder kind of figures out this new environment where it doesn't have the obstruction anymore, by the time the Botox wears off in 6 to 9 months, you're a new person, and all we did was retrain your bladder, this new behavioral therapy. So there's lots of different ways to look at it, and that kind of gives you a brief summary of what to expect after the procedure, but the procedure is great now. There are different ways to do it. Consult with your physician or nurse practitioner or physician assistant. It's a great procedure, and if I get any BPH issues myself, I'm gonna take that medication for 2 weeks and probably jump right to the procedure.